No one came out and ever said, actually, this is something that's, more common than we think. No one has ever said that. So this was just, it was bizarre, I think, was the adjective I used with you when you first described this to me, Wolf, more than 2 years ago. Now, what was interesting, when we were watching this case, and I was out in Los Angeles for some time, I thought that the defense would try and make the case with their experts. But look, this isn't that unusual a situation. You know, propofol is something that's used in hospitals, but it's also used in clinics, and could it also be used in other sort of settings? They never made that case. Dr. Paul White sort of focused more on this idea that maybe Michael Jackson injected himself. So I thought that was all sort of fascinating. In the end, obviously, we know how the jurors interpreted all that.
And propofol, correct me if I'm wrong, Sanjay, something that a physician would give if you're going to get a colonoscopy or something like that to put you to sleep. But they're very carefully monitored in a situation like that.
Yeah, there's some very specific requirements. First of all, propofol is a medication used in operating rooms to induce general anesthesia. It's used in intensive care units for patients who are getting procedures, for example, in the ICU. Also, as you said, Wolf, for minor procedures, patients who need to be sort of out for a little bit of time. It's not sleep per se, which was another issue that came up, Wolf. This is literally being anesthetized, so it's not very restorative in terms of sleep. But yeah, this idea that there's someone needs to be present. You have to have resuscitation equipment around. You have to have monitoring equipment around, and certainly, the patient needs to be monitored the entire time they're on propofol. Those are pretty standard procedures, but obviously, many of those things weren't followed here.
I can't tell you how many doctors over the past couple of years have said to me they were outraged when they heard about the use of the propofol to try to get Michael Jackson to sleep in his home. I never spoke to one doctor casually or on television or whatever who thought this was normal. So the notion of involuntary manslaughter, certainly I think the medical profession, your colleagues out there, the doctors who are watching and who watch this very closely, they're going to get a lesson from this. An important message is being sent out there.
Well, yeah, but I think most doctors, as the lay public, sort of, thought what you're describing, though, Wolf. So I'm not sure exactly what the lesson was for most doctors, because it was outrageous then, or remains outrageous now. I think what is interesting, Wolf, just to give you an idea of just how strange this is, propofol as a substance is not even considered a controlled substance in the way that many narcotics are, these painkillers that we've been talking about. In part because no one could even, I think, imagine or envision a situation where it would be abused in this way. It is a drug that has been abused, in hospitals, for example, even by anesthesiologists. But to abuse it in this way outside a hospital, outside a clinical setting, inside someone's home, I don't think anyone had even considered that as a possibility.
And the notion that he was getting paid by Michael Jackson $150,000 a month to be his personal physician, I don't know if that